starting. Oh.
Have you ever wondered what a blood pressure is? It's the pressure that the blood exerts on the vessel walls as a result of the pumping action of the heart. An accurate blood pressure reading is a key gauge of a patient's overall health. Everyone has been to the doctor and had their blood pressure checked. This is important because it provides the physician with an overview of the patient's overall health and circulatory status. A normal blood pressure reading for an adult is 120/80. A low blood pressure reading is called hypotension. Hypotension usually starts about 100/60 or lower. A high blood pressure reading is called hypertension. Hypertension starts at readings of about 160/100 or higher. So many people today are being treated for high blood pressure with medication. It's not necessarily determined by obesity or you could be at a healthy weight and still be diagnosed with high blood pressure. Excessive or abnormally low pressure may lead to complications or related medical conditions. High or low blood pressure readings provide information to the doctor that they use to make a possible diagnosis or treatment. I've been a nationally certified medical assistant for 2 years now, and I work with one of the busiest family practices in this area. Today, I'm going to show you the medical equipment needed and the steps that are necessary to accurately obtain a blood pressure reading. First of all, you have to have one of these. This is called a sphygmomanometer, You also have to have a stethoscope. And of course, you also have to have a patient as well. So I'm going to use Tiffany here for the demonstration. Now that we know the necessary equipment needed, we can begin the procedure. You're going to first have your patient sitting in a chair. Can you uncross your legs for me? You don't want the legs crossed because that can give you a false reading. Arm needs to be resting at or near heart level, so they can just be in a chair or on the exam table. And then you're going to place the cuff right around the arm. And most of them have these gauges that tell you want to center this right over the brachial artery, and you want to make sure that you have a nice snug fit around the arm, and want to be able to read the gauge there. Then you're going to take your stethoscope, and it's real important too on these that you have these facing outward towards the patient when you put them in your ears. I'm going to take this part and I want to place it right over the brachial artery. I'm closing this right here. You want to make it tight so I can pump it up. You're going to pump the bulb pretty fast, and I'm going to pump her up to about somewhere between 160 and 180. And then you slowly let the air out. And you want to let the air out at about 2 to 3 millimeters per second, kind of slowly. And what I'm listening for, or what the person is listening for when they do this, is the first time that you hear the heartbeat when you're releasing it is your systolic pressure. And you want to just kind of mentally note that when you're listening. And then the last time that you hear the heartbeat is your diastolic pressure. And after you're done, you're just going to remove the cuff from the patient. Once you've done that, you're going to document your reading. And it's written as a fraction. You're going to have it written down as, like I recorded hers at 116/78. And so again, you just have the patient sitting down. Also, too, it's real important that they haven't exercised, smoked, or drank alcohol within the previous 15 minutes of prior to taking the blood pressure, because that can also alter the reading. So again, just have them sit in the chair, arms at heart level. You pump up the cuff, listen for that first beat. You're going to listen for the last beat, record the pressure, and you're going to provide that information to the doctors so that they can determine and go from there as far as what they're going to do with the patient. Thank you very much.